Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. Over the past 2 days, I have received dozens of questions regarding how will a woman's health care be affected in a post-Roe versus Wade United States. Well, first, most of these questions are coming from the pro-life generation, which are those that are under the age of 25. And I am so proud of them. You know why? Because they are engaging in discourse, not destruction. I will say that one more time. They are engaging in discourse, not destruction. But some of the questions they are getting are a little bit deep and medically oriented, so we are going to teach them how to answer those questions with scientific and medical excellence, because that is the role of a physician, to teach. I've delivered over 4,000 babies, and my first priority upon labor and delivery is always a healthy mom and a healthy baby. So let's start our training. First, what is an abortion? An abortion is when the life of the baby, whether medically or surgically, is taken and it poses no threat to the physical health of the mother. So you have a healthy baby on the inside and you have a healthy mom, and because there is a choice, the life of the baby is taken even though it was posing no direct threat to the health of the mother. That is an abortion. So the first question, most common question people are asking is, if a mom has a miscarriage, she's pregnant, she comes in for an ultrasound, she might be 8 weeks along, and they see a baby on the inside with the placenta and all the fluid, but the ultrasound shows that there is no heartbeat. Well, the ability to have access to a D&C, to empty out the uterus, to remove, unfortunately, the baby, the placenta, and that fluid, that will not be delayed in any way if that is what the woman chooses to do, as long as there is no heartbeat. So if you have a miscarriage and you haven't passed anything, you can still get the D&C, and these changes will not affect that at all. Second, ectopic pregnancy. About 1% of all pregnancies are an ectopic pregnancy. The most common pregnancy-related cause of death in the first trimester of pregnancy is a ruptured ectopic pregnancy. That's where, yes, you have a positive pregnancy test, but the pregnancy did not come down to the lining of the uterus. The pregnancy is somewhere else. It's ectopic. Most commonplace is in the tube. That is a pregnancy, and even when it has a heartbeat, that is a pregnancy that is directly a threat to the physical health of the mother. So will the reversal of Roe versus Wade delay either the medical or the surgical treatment of an ectopic pregnancy? In no way whatsoever. If you come into the emergency room and you have an ectopic pregnancy, even if it has a heartbeat, we will immediately be able to take you to the OR and remove that threat to your life. So there will be no delay in the world where Roe has been reversed. Third question we've been getting is, if I happen to be pregnant and I break my bag of water and now I have an infection in the uterus, but the baby still has a heartbeat, will the changes and reversal of Roe affect my ability to get health care? Absolutely in no way, shape, or form. Now, if you break your bag of water early and you're 23, 24 weeks, what do? Well, yes, we give you antibiotics, but your life is directly threatened by this pregnancy. So we would induce labor. We would induce labor to empty out the uterus and then send the baby to our neonatal intensive care unit and give the baby every opportunity to survive. When a woman has an infection on the inside of the uterus, killing the baby does not help the mother. It is the emptying of the uterus and the delivery of the baby that helps the mother and will cure the mother. Now, if that bag of water ruptures at, say, 14, 15 weeks, really early, and that is extremely rare, and there's still a heartbeat, but there is an infection, then we need to empty that uterus. So we would need to induce labor and deliver that baby on the inside. So will women's health, her physical health, be threatened because Roe versus Wade has been reversed? In no way, shape, or form. You can still have access to a suction D&C. You can still be treated either medically or surgically for an ectopic pregnancy, even if it has a heartbeat. And you can still have treatment for a uterine infection because it is directly affecting your life. So we will keep these answers coming. You keep the questions coming. Do not be dissuaded and do not be afraid. What your heart is telling you is that the preborn are persons, and they are my patients in the womb, and we need to defend them. So I will give you all of the answers to all the questions that I have so that you too can defend the preborn in the womb, because a patient is a person, no matter how small. You can contact me through my website, which is prolifedoc.org. God bless you and have a great day.